we are back. My name is Vince Anger. I am your host this morning. I mentioned that today is Tuesday, October 18, 2016. How many of you out there know that this day is National Meatloaf Day? I'm rather expecting that Diane, the station manager, will come into the studio sometime live on television with a plate of meatloaf for the guests and me. George Morales is with us this morning, and George is the director of Garden Ridge. Welcome back, George.
Thank you.
Good to see you. And you have some, I'm going to let you talk about Garden Ridge. Garden Ridge. You have some updates.
Okay. Yeah, we do. We've had a very busy last several weeks since I've been here on Channel 6 with you. But probably the most exciting news we've had has to do with our recent annual survey, inspection of our assisted living facility at Garden Ridge. So each year, it's a state requirement that each assisted living facility is inspected to ensure compliance with all the regulations, standards for assisted living facilities. And it's a very in-depth inspection that's conducted by the County Department of Social Services. And we're very thrilled with we had excellent results from that survey. We did have 3 minor deficiencies, which we've implemented a formal plan of correction to correct those issues, which were all minor and well below the state average in terms of number of deficiencies. So we're very happy about the outcome from that survey. Again, it's a testament to the good quality of care that's provided by our staff at Garden Ridge, and we're excited to continue that into the future. And to go along with that, the results of the survey is we're actually today are having some staff celebrations to congratulate the staff on an excellent job with the survey and their performance over the last 12 months. To have a good outcomes with the survey. And so early this morning, about 6:30 in the morning, so a lot of our leadership staff pulled together along with the dining services, provided a meal. We had omelet stations and buffet style waffles.
Where was I?
We'll have to get you the invite for the next time. And so we had a celebration this morning, and we're also having another evening celebration to make sure we recognize the different shifts that work at Garden Ridge. That'll be this evening for our second and third shift staff, and we'll be providing a dinner meal, again, served by our facility and Green Spring leadership. Our executive director and associate executive director also came to help, as well as several of our executive team leaders throughout the Green Spring campus. So we had a big effort, again, to congratulate the staff for an excellent job and for continuing to provide good quality care to our residents here.
Yeah. You are subject to inspections, evaluations by the county, but by the state as well, and who else?
Yes. So let's see, to break it down. So for the assisted living that I just spoke of, that is that license is regulated by the local county Department of Social Services. That's the same holds true for memory care, because that is also memory care is also an assisted living level. On the skilled nursing side, which includes our long-term care on RC4, RC3, and also our short-term rehab on EV2, that is regulated through the Virginia Department of Health, which is a state-level agency. And there's a regulatory branch within that department that conducts inspections for nursing facilities, which is very heavily regulated, lots of regulatory standards and code that have to be met, that we must be in compliance with. And that is also done on an annual basis and as needed. If there are complaints called, then there's a survey process for that as well.
With all of this regulation, do you have law in your background anywhere? You need a lawyer.
The healthcare today is going that direction. Obviously, we've always had pretty heavy regulatory standards on healthcare providers, but yes, there's a great deal of responsibility in ensuring quality of care, and there is a lot of oversight to ensure quality of care, that costs are controlled, and then we're seeing that on the federal and national level, and also at the local facility and local provider level also.
Yeah. if I recall correctly, you have a couple sisters.
I do.
One is a lawyer, if I remember correctly.
Yes.
Do I remember that? Yeah.
Yes.
So yeah, you
Yes.
could bring her in. And by the way, I'm going to ask you about your other sister here before we're done. But I'm just wondering, what is the total staff at Garden Ridge?
So at Garden Ridge, there are a combination of full-time, part-time, and as-needed staff. We are, I believe the numbers are pushing close to 300.
Yeah.
And that includes the nursing department staff, certified nursing assistants, licensed practical nurses, registered nurses, our nursing administration team. It also includes staff from the housekeeping and laundry, dining services, therapy services, and all the different departments that make Garden Ridge what it is.
Sure. And now, and you've got business front office people over there, business administrative functions going on.
Yes. We have our business office manager, which we actually just recently filled that position.
Sure.
And she started yesterday with her orientation. Comes to us with a lot of experience in the business office. Usually, the support and help she can provide is answering questions about monthly statements when there's questions, if there's questions about insurance coverage or copay questions. That's a business office manager can really help folks to navigate some of those things. It's very complicated, especially in a nursing facility and long-term care environment, because there's so many different rules, Medicare guidelines, and all those types of things.
Yeah. You know, before my wife and I moved here, my wife went into Fairfax County, Fairfax Hospital in January of 2011, and is that right? Yes. And I kind of decided I'd like to have her come here to Garden Ridge for her rehab. She had a male nurse who had previously served, I guess, in the military with the director at the time, and he kind of pulled some strings for me, I think, to get Mary Ann.
Okay.
As I remember it, Green Spring had a rule that said that Garden Ridge would not accept anyone other than a resident, and we had not moved in yet, so they made Mary Ann a resident. And in the front office, we're down to 5 minutes here. I'm chewing into your time here.
That's fine.
In the front office, I signed. At one point, I asked I think it was the assistant or associate director. I said, "How many times have I signed? How many pieces of paper I've signed here?" I was up to 23 pieces of paper. And to make Mary Ann eligible, they made Mary Ann a resident. And I signed a piece of paper without blinking that I owed $106,000 on the room, you see. I don't know how this works now. So one subsequent day, I was having lunch with Mary Ann and other residents in Garden Ridge, and it wasn't Garden Ridge at the time, but Garden Ridge now. And I just happened to mention that I owed Green Spring $106,000. And I should have been careful. It really upset one of the other residents and one of the other patients because his son had made the arrangements for him through the business office. You see, it upset. He came to my table the next day and he said, "I owe Green Spring $106,000." And I said, "Don't worry about it. If you don't pay it, they'll throw you out," which is what rehab is all about in the first place, isn't it? So, now, when you have to staff, how does that go about, staffing? You go to homes, or yes, you go to our human resources, I presume.
Yeah, so for our recruiting and hiring efforts to fill open positions, it's definitely a team effort. Our human resources department does a lot of the work for us, for the hiring manager. So when a job becomes available, Human Resources takes care of posting that position, both internally for current Green Spring employees, but also on external resources. So it's available to staff who may be working at a competitor or somewhere else in the area. Mm-hmm. And again, Human Resources drives that process in receiving the applications, screening to make sure we have qualified candidates in the pipeline, so our hiring managers and leadership have an opportunity to conduct interviews, get to meet folks. That is a very important part of the hiring process here at Green Spring.
Extensive, isn't it?
It's very extensive.
Yeah.
It's very extensive. And I think it's important for it to be extensive.
Sure.
You know, we are all about building relationships with our staff to provide quality care, and a lot of that starts in that introductory phase and getting to meet people and having our prospective candidates meet different leadership at different levels and see how they communicate, how they respond, to make sure that they're going to be a good fit for our team here.
Yeah, yeah. We're down to less than 3 minutes here, George. I want to. We mentioned that one of your sisters is an attorney. You have a sister who is a. Is she with them? She's an opera singer.
She's an operatic soprano.
And with New York.
So she's based in New York. She's currently not with an opera house or theater company currently, but she is performing as she had done so here at Green Spring in, I believe, September. She did a performance at Garden Ridge, which I think was very well received, and we are actually hoping we can have her come back to Green Spring to do another concert.
Yeah, I was going to ask you, when are you bringing her back? Yeah, she's wonderful.
I know that she's been in contact again with some folks here to talk about a concert down the road, another concert at Green Spring.
Yeah, good. At Garden Ridge, but maybe in the theater downstairs.
Yeah. Actually, I think the discussion about a future concert would be something that, since we had a concert at Garden Ridge, maybe this time it could possibly be in the independent living, perhaps at the theater. I know that's an ongoing discussion, and hopefully we can work out the details and logistics, and we can have her back.
Yeah, it was wonderful. Okay, I don't know how much time we have left here. George, what do... it looks like maybe a minute. We're down to about a minute. What else would you like to say before we close it up here?
Well, just again, thank you for having me here on Channel 6, and maybe the next time there's a month of Meatloaf Day, Diane can treat our wonderful hosts and any hungry guests who may show up with some fine baking and cooking skills.
All right. Yeah, good. Thank you so much for coming, and I look forward to the next one. Another couple of months, you'll be back, or you'll be back every month, I bet. Another couple of months, I'll be here to interview again, I bet.
Okay.
Stay with us, Green Spring. We will be back.